I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Back in July, the World Health Organization declared monkeypox a global emergency. And yet, these days, you barely hear about it. Welcome to Inside the Issues. I'm Alex Cohen. In fact, we don't even call it monkeypox anymore. Shortly after that announcement by the World Health Organization's Director General, officials started to recognize that the simian moniker, which had been in use since 1958, was pretty stigmatizing to human beings. Soon after, many in the world of public health decided to ditch that monkeypox label and opt for something that sounded a little bit like a Hanson song instead, Mpox. Mpox was looking pretty scary for a while last year. Those who got it often suffered for weeks. At first, vaccines were few and far between. Folks waited in line for hours to get this shot. Critics were outraged, and some said that local health agencies were just not doing enough to keep Southern Californians safe.
The public health department needs to always rely on the community and the agencies that we have to make sure that we can make access and be equitable to everybody.
But as summer came to an end, the number of Mpox cases began to wane. To date, there have only been 2 deaths in LA County and fewer than 2,500 Mpox cases. For more on how we managed to avert a greater tragedy on this front, we're joined in studio by Dr. Tony Mills. He's CEO of the Men's Health Foundation. It is great to have you back with us to talk about what seems to be pretty good news.
Thank you, Alex. Great to be here.
So I want to kind of rewind back. The last time we had you here to talk about this virus, it was just about half a year ago, 6 months ago, and we were beginning to see cases taper off. Do you remember at that time thinking, okay, we're going to be fine with this? Did you ever think that we'd be kind of at the place that we're at now?
Well, I think that, COVID really put a lot of fear in us. I mean, monkeypox really behaved like an epidemic usually behaves. We saw a surge, we saw rallying of the troops and changes in behavior and vaccines, and then the number of cases fell off. What was unusual was the way that COVID behaved, being so prolonged. Monkeypox behaved a little bit more like a usual epidemic behaves.
We were talking before the show got started, and you mentioned you were just at a big conference in Seattle where there was a lot of talk about Mpox. I'm curious, is this kind of what we're seeing all over the place? Is Southern California a bit of an outlier, and what might explain some of the differences?
Well, I think the U.S. is a bit of an outlier. I mean, we certainly had the highest percentage of cases. 30% of the cases worldwide were in the United States. The second highest country was Brazil, and that was 10%. So we certainly had our share of the epidemic to deal with. Yeah, it has a lot of interest for people because I think coming on the tails of COVID, we utilized the lessons that we learned in COVID, which was great. We were really able to mobilize resources, and we think that's really the reason we were able to get things under control so quickly. Yeah,
and I think one really key point here is comparing and contrasting what happened between COVID and Mpox with vaccines. Of course, vaccines were very much in short supply at the beginning with both of these viruses, but with Mpox, things got a little bit different in terms of how we use what we did have creatively. Can you remind us, Dr. Mills, what health officials here decided to do, and maybe share with us how big of a game changer you think that was?
Sure. I think the thing that was interesting about monkeypox was the vaccine that was best tolerated, Jynneos, is made by this tiny vaccine company in the Netherlands. And so I think, I imagine them sitting around in May and, the phone's not ringing and they're going out for 2-hour lunches and they're thinking, we don't have anything to really offer. And then suddenly there's this huge epidemic worldwide and they're the most desired vaccine on the planet. So they're a very small company. They can only make so much. So it was a matter of trying to mobilize those resources. Fortunately, there had been studies done previously. We started dosing it as it was recommended subcutaneously, but there have been studies done previously in the event of a super crisis, a smallpox crisis really. Can we dose this at a smaller dose in a different way, intradermally? And so we did have that data. So initially we started subcutaneously, and then we realized, wow, this is a big epidemic. We need to really vaccinate as many people as possible. And so we switched to the intradermal route.
There was a very big difference between COVID and Mpox. COVID pretty much was infecting everybody very quickly. Mpox primarily affected men who have sex with men. And of course, this is a demographic which, you know, has a long history battling and surviving various public health crises. Do you feel like that made a difference in terms of how we were able to get a handle on this particular virus?
I think, you know, what I remember is we were learning so much every day. You know, we had Mpox outbreaks, monkeypox outbreaks in Africa before, but it was a different strain of the virus, a different clade. It behaved differently. The transmission was differently. Suddenly, we see it in men who have sex with men, and it's behaving differently. It's not as lethal, but it's much more transmissible. So we're just trying to learn every day. And there's still a lot of people in the community that are angry with us, thinking that we didn't do as well as we should have. We did the best we could because it was a new epidemic, really. It was a whole new, this clade 2B of the virus. You know, we were still learning how it behaved. So I think that we mobilized our resources as best we could.
Yeah. Dr. Mills, I noticed just now you said both Mpox and monkeypox in the same sentence. I do it too, right? Even though we made that shift, I think a lot of folks still think of it as monkeypox. But a lot of people did use Mpox. The last time we had you here was just kind of at the beginning of that shift. Do you feel like that influenced the trajectory at all, just kind of how we thought about this virus or talked about it?
I think, you know, it possibly increased the number of people who got vaccinated because there were people who were very offended by the name monkeypox. And when I used twice in the same sentence there, I used monkeypox kind of referring to the old days and Mpox referring to a current time period, which is just how it is in my brain. Yeah. But I think that there were people who didn't want to get a vaccine called a monkeypox vaccine, and there were people who would have more willingly gotten a vaccine called an Mpox vaccine. So I think that, you know, there's an interesting movement right now going on to try and rename HIV because of this huge stigma that's always been associated with HIV, and we can't get on the other side of it. So let's rename it. And that's what we did with monkeypox. You know, there was this huge stigma associated with the virus because of the name. Let's rename it. Let's try to make it more manageable and see if more people will get treatment that they need.
I just have to ask a quick follow-up question there. Is there another name that they're thinking with HIV that they want to move to, or is that a whole other? That's
a whole other discussion. They haven't proposed a name yet. It's a group of youth who are really doing this. It's a fascinating project. But they've got a lot of support behind them, and I think it's really the discussion. I don't think it's necessarily giving it another name, but just saying, you know, this disease is so stigmatizing, and we're not able to get on the other side of it, and that's preventing people from getting treatment. It's preventing people from getting prevention. So let's talk about the stigma, and maybe renaming it might make a difference. So I don't know that renaming it's really going to make a difference, but I think the talking about it is going to be really important.
That's so fascinating. Okay, let's go back to getting on the other side of. We're not necessarily on the other side of COVID, but do you feel like there's anything from the Mpox experience that we can learn when it comes to whatever next phase we are in with coronavirus?
I mean, I think what we learned was that the lessons we learned from COVID were very beneficial, and we implemented them, and we really mobilized public health resources, and we got on the other side of it. I mean, we did a really great job. So I think that that is reassuring as we deal with maybe potentially another wave of COVID in the future. You know, hopefully, you know, monkeypox is interesting because, as I said, it's become less virulent, but more transmissible. And that's really what we've seen with COVID as well. So as long as it's moving in that direction, I'm very happy.
Yeah. You talked about stigma. For many, many years, there has been the stigma around gay men donating blood for fear of HIV. Now, the FDA is considering revamping its rules around that. They're in the public comment period right now. What impact do you think it's had on gay men when, you know, when folks are saying, no thanks, not your blood for donation, even though we very much need donated blood.
Right. I think it's going to have a tremendous impact. I think that, gay men felt like pariahs. The Red Cross is calling out for blood donations because the supply is so low, and yet we can't contribute. So I think that, that hurts. And so I think that what this will do, I mean, what they've essentially changed towards is looking at the individual, not a big class of people like gay men, but look at the individual. What is this individual's risk factors for HIV? And if those risk factors are high, then probably not the best time for you to donate, or you can wait for a period of time and donate. So I think that it'll be very reassuring for gay men that they're not pariahs and they're not disease carriers.
Dr. Tony Mills, it's always great catching up with you on all these important public health issues. Thank you so much.
A pleasure to be here always, Alex. Thank you.